What's going on? It's that time again. We made it to the midway point of the week, which means it's time for another episode of Over the Hump. This week we're going to be talking about shoulder pain, which is one of my favorite areas to treat in the body. The shoulder can be kind of tricky to treat, especially when you consider all of the moving parts, right? There's really more than just the shoulder joint itself, which would be the glenohumeral joint. There's also the scapulothoracic complex. There's the AC joint where the clavicle meets up with the acromion from the scapula. So there's all these different moving parts in the shoulder complex that have to be considered when we're trying to diagnose what is actually causing the pain symptoms, and especially when we're trying to actually develop a group of exercises to more properly address the root cause of the problem. To make things even more complicated, imaging in the shoulder is often not super effective. This is what I actually went to San Diego last year and did my poster presentation on for my fellowship project. But I made the argument, when you look at all of the research, there are so many incidental findings in the shoulder and so many different areas of pain presentation overlap from referral sources in the shoulder that you really can't draw a very good conclusion when you look at an MRI or an X-ray as to what is causing the pain. Much like low back pain, where we've talked about that, 50% of the population over 50 years old has a disc bulge. So when you MRI someone's back and you see that they have a disc bulge and you say, hey, that's what's causing your pain, you can't really say that because we just don't know. It would need to match up with that person's clinical signs and symptoms and retest results to actually decide which tissue structure is causing the pain. The same is very true in the shoulder. The good news is you often don't really need to know what structure is causing the pain in order to treat the pain, especially at the level of complexity that I'm wanting these home programs to be. So I just want to give you guys a few different thoughts and ideas and exercises that you probably have not seen or tried before in your shoulder rehabilitation program and see if these might work for you. So let's quickly break down the different parts of the shoulder complex so we can understand each joint's role a little bit more clearly. The main joint of the shoulder, the one that we all think about when we're talking about shoulder movement, is the glenohumeral joint. This is your standard ball and socket joint that does provide most of the motion at the shoulder. The second main junction is the scapulothoracic joint. This is the shoulder blade moving on the ribs, and it does actually provide quite a bit of motion as well. The third main component would be the AC joint. This is more of a planar joint, but this is where the collarbone is meeting up with the scapula, and it pivots as the shoulder complex starts to move. As the scapula rotates upward, it does need to be able to pivot at the AC joint. There is also the SC joint where the sternum meets the clavicle. That one doesn't move as much, and it's typically not as implicated in shoulder pain, but if you are having pain more near the mid-sternal line, it could actually be a very relevant source for you. All right, so the reason I think it's so important to understand those different parts of the shoulder is because this one in particular, the AC joint, to me is one of the most commonly overlooked areas that contribute to a lot of people's shoulder pain. This was the main thing that I did my research project on, and clinically I just find this particular joint to be super valuable. So I want to take a little bit of time and show you guys how you might be able to test that out at home to see if it's contributing to your symptoms. All right, so if we're thinking that we may have an AC joint issue, this is the easiest way to test it. We're going to get up against a wall so that it holds our shoulder blade in place while we're trying to mobilize this joint. So I want you to get your shoulder blade flush up against the wall and kind of lean back, and then from there, let that arm totally relax. The next step is we need to get medial on the collarbone to the AC joint. The AC joint is going to be where there's a bump near the end of your collarbone as you're tracking it out towards the shoulder. So find that bump, come just to the inside of it, and then you're going to be on the collarbone. From here, we're going to simply spring the joint. It's a planar joint, so all we need to do is wiggle it for a while, get a little lubrication in there, and see if it changes our symptoms. So I would want you to have some type of retest. Maybe that's reaching the arm up overhead or out to the side or whatever position normally gives you your symptoms. And then we're going to check that again after doing this mobilization. So make sure the shoulder blades flush up against the wall. Our arm is relaxed. We're going to take a towel right over that collarbone point that we identified that was just medial or just inside of the AC joint. And then we're simply going to push directly back into the wall for 30 repetitions. This should not cause pain. If it is causing pain, I would say there's a pretty good chance that the pain you're experiencing is from the AC joint, But if this is causing pain, there's a chance that the AC joint is a little unstable and you shouldn't be doing this mobilization. At that point, you would probably need to go in and see a provider or an orthopedic specialist to check out your shoulder a little bit further. But if it's not hurting, I would really just gently kind of mobilize this for about 30 reps, just pushing straight back into the wall on that collarbone gently. That gets a good amount of lubrication going in the joint. And then you can come up, you can retest that joint position or that movement pattern that was previously painful and see if your symptoms have improved. Because we've only mobilized the AC joint and we haven't really touched any other part of the shoulder, if your symptoms are better, there's a really good chance that most of your symptoms are being generated by the AC joint structure. So that helps narrow that down for that joint. All right, so what do you do if you go through that quick test at home and you realize that the AC joint is a contributing factor, at least to a percentage of your shoulder pain? What I want you to do is start doing that mobilization gently 20 to 30 times before doing your overhead exercises that we're about to walk into next. All right, let's move into some overhead shoulder exercises for the stability layer of the shoulder. This is where I personally feel like we have the most room for improvement with the typical home exercise programs that I see most people come in with that have not been successful for their shoulder pain. 9 times out of 10, if you have shoulder pain and you go visit a PT, they're gonna give you some exercises that look like this for strengthening external rotators, and maybe another one that like comes from that way and you're pulling in. So you're doing external and internal rotation with resistance. Maybe if you're lucky, they've got you rolling a foam roller up a wall. That's a good one. But I feel like, or you're laying on your side with a dumbbell, right? And twisting here. I feel like everything that we do, for the most part, for the rotator cuff or that stability layer, we're doing down here at 0 degrees of shoulder flexion. So we're doing it in the furthest position typically away from where our pain is actually happening. Most of us have pain in the shoulder either when we're like bench pressing or doing pull-ups or doing a tennis serve or reaching up into a cabinet. So training the shoulder down here doesn't necessarily carry over to those overhead positions. We're getting the rotator cuff more efficient at neutral, but it needs to be able to stabilize and center the ball in the socket throughout those other positions of shoulder motion, and we're not training it to do that. There's only so much carryover in terms of position if you're training it in one position and asking it to perform in the other. So I really think we need to rethink the way that we're prescribing or performing exercises for the shoulder stability layer at home when we're doing it for a rehabilitation purpose. All right, so the first exercise that I'm going to show you has 2 major goals. One is to start reducing shoulder pain in the overhead position, and the other is start to change the firing pattern of taking our shoulder into the overhead position. We're always using the same groups of muscles to lift our shoulder, and after a while, once we've experienced pain with that particular firing pattern and that particular joint position for a long time, the brain starts to brace for that firing pattern or that position. We need to get that protective mechanism to shut down. So this exercise does a great job at doing it. We're gonna sit in a chair with a band anchored in the top of a doorway behind us. That's pretty much the easiest way to go about this. And you need a pretty good amount of resistance because we're wanting the band to lift the arm. From here, we're holding the arm about 90 degrees, and I'm gonna let the band just slowly lift my arm up as high as I can go without any pain. From there, I'm gently gonna turn those muscles back on and bring it down to about 90 degrees. You don't have to bring it all the way back down to 90. If you just want to go from about 180 to 140, that's fine, whatever your range is. But the idea is that we are very comfortably and very relaxed while the shoulder is moved into this full overhead position and then back down. This starts to get those rotator cuff muscles gently turned on and allows a lot of the other muscles that typically have to be working hard in this overhead position to just relax for a while. And it helps the brain recognize that this is not a threatening position and it doesn't need to brace or protect or guard for the shoulder going up overhead. So often we have kind of a disorganized firing pattern or a compensation of firing muscles that bring the shoulder up because we've had pain in those positions for a long time, and we really need to just work to unwind that process for a little bit before we spend too much time strength training in these overhead positions. This is a great exercise to do it. Typically 2 rounds of 20 repetitions is an awesome dosing for this exercise, and it should be done in the beginning of your routine to work through pain. All right, guys, moving on to the next 2 exercises, which are kind of therapeutic and diagnostic depending on how they go, but they really help to lead us to the best cluster of exercises for your shoulder pain, which is the goal of this video. So again, I want your rotator cuff to start being more active and participating more in all degrees of shoulder motion, not just down here at the bottom. So we're gonna improve on that exercise I talked about earlier that I think is kind of underwhelming, and we're gonna take it into an overhead position. So I want you to grab the band just like you would in a neutral, we call this no money, but basically a neutral shoulder external rotation. And we're just gonna go into about the first 10 degrees of that with each arm. This lets us have an isometric contraction of the shoulder external rotators. So this is very helpful if you have pain with reaching overhead. I want you to find that pain point with no contraction. Then I want you to activate the external rotators and bring the arm up to that same position and see, did it change your symptoms at all? Maybe it made it worse, maybe it made it better, but if we hold an isometric external rotation and then lift up forward and our pain goes away compared to how it was without the contraction, we need more input from the external rotators. The next step would be to do that exact same thing with isometric internal rotation. So if I take a boat buoy or something else similar that keeps my shoulders in a relatively neutral position, and I try to squish this thing together as if I was doing internal rotation of the shoulder. So I'm gonna try to squish it together, and then I'm gonna reach up through that same position of shoulder flexion. If I do that, does it change my symptoms? Does it make them better or worse? If it makes your symptoms worse, you know not to do that. If it makes them better, hey, maybe you need more input from your subscapularis, which is one of your major internal rotators, as you go through shoulder flexion. So this really helps bias us towards knowing, one, what exercise to do, because the test becomes the exercise. This is so valuable at helping to restore pain-free shoulder motion, is to simply do the one that works best for you. If internal rotation reduced my pain, I'm gonna push into this boat buoy gently, and I'm gonna up overhead and down, and I would do a couple sets of 15 of that before moving on to my next exercise. That's a great way to start getting that rotator cuff more engaged during overhead motion patterns. Alternatively, if external rotation reduced my pain, I would externally rotate into the band and do 2 sets of 15 shoulder flexion with external rotation. If both of them reduce your pain, then I think you should do both of them. And maybe you just need more rotator cuff input in general. But this is leading us down a thought process of what to do for your shoulder versus just blindly giving you exercises and seeing how it is when you come back. Every exercise has a thought and a goal behind it, and then that leads you to the next exercise. All right, guys, that's probably enough things to be thinking about for this episode of Over the Hump, but the big takeaways from this video that I want you to consider is that when we are training the rotator cuff of the shoulder, we need to be doing it in the positions that most closely correlate with where you're feeling your symptoms. Training the rotator cuff in neutral with internal and external rotation is very inadequate if our pain is happening during a bench press or incline press or pull-ups or any of those types of positions. We need to be training the rotator cuff as closely as we can to the positions that we're having our pain. The shoulder is the most mobile area in the body, and because of that, it requires that the stability system be very active and efficient at stabilizing the joint and maintaining a good position of the ball in the socket. These exercises can help you to do that. So check your AC joint. If the AC joint is a contributing factor, definitely work to gently mobilize that before your overhead or your upper body lifting days. Try to work on that assisted flexion exercise to reduce the amount of pain that you have going into an overhead position, and then use our 2 diagnostic or therapeutic exercises to figure out whether you need more input from the internal rotators or the external rotators, and pick the one that works best for you. Typically, dosing wise for those would be 2 sets of 15 to 20 repetitions with either isometric external rotation or isometric internal rotation, or both if both actually made your shoulder feel better. And that's a pretty good place to start for your upper body training days. And then you can take it further from there depending on what you needed. Thank you so much for watching this episode of Over the Hump. I hope this was helpful. Please shoot any questions that you have into the DM box and I'd be happy to answer those with you. And we'll wait to do another one of these next week. Thanks for watching.